There we go. Welcome. It's so lovely to have the amazing women's health GP, Dr. Michelle Cotellessa, with us tonight. I'm so excited for Michelle to be on here because I've had lots of questions since Michelle and Sunita's names have come up on our website and they've arrived at WOOM. What is a women's health GP? But before we get to that, I want to introduce you to Dr. Michelle. And Michelle, tell us a little bit about you.
Okay, well, hi everyone. I'm Michelle Cotellessa, and I've just started at WOOM probably in the last 4 or 5 weeks. So a little bit about me. I was born and raised in Perth. Both my parents were born in Italy, and I've been in, both have been in Australia since childhood. I have a younger sister and a brother-in-law and 2 nephews. I didn't come from a family of doctors, but both my parents were business owners. And somehow I knew very early in life and early that medicine was a career for me. So I completed my degree in 1994 at UWA. Spent about 3 years at Royal Perth, working in many different subspecialties as an intern and as a resident. And I did about 6 months of geriatrics. So it was a great start to that. But I've always really have had a very special interest in women's health. And I worked for about 6 months in King Edward, and then I loved that and studied and did my diploma in obs and gynae. So that's how my journey sort of started there, and then continued my 4 years of training in general practice and finished in 1999. So I've been working for about 22 years as a GP. So as well as a session at WOOM, I work as a GP as well. So in Mount Lawley. So that's a little bit about me. I am a mum and a wife. My husband's an anaesthetist, and I've got 2 teenage children, a 16-year-old girl and a 14-year-old boy. So that, you know, that sort of, I guess that other thing is all about career, you know, working as a mum and having a career in general practice and women's specialty health. I think you gain a bit of insight and knowledge as to how women, you know, how women cope with life in general.
Yeah, love that. I love the fact that you're a mummy juggler as well, Michelle. I think that's what makes it really special as a women's health GP, that you've not only done the medicine, but you've walked the path as well, that many women are coming to see. So a question that is often asked is, why would a woman come and see a specialist women's health GP, either instead of or over and above their own GP? I think that's a really important question to try and answer.
Sure. Well, I guess, you know, primarily I am a GP, and GPs are most likely your first point of contact whenever you are sick or whenever you really want some health advice. So as myself as a GP, we do focus on the general person, the physical, the psychological, and the social aspects of care. So it is very important that you have a great relationship with your GP, because everyone wants that feeling of connectedness, right? And it matters to people, and it especially matters in healthcare. So when it comes to women's health, I think, or in health in general, there are very specific things, I think, that are the crux of women's health. So certainly things like, you know, I can name a lot of them, you know, periods and menstrual cycles and period pain and cervical screening and menopause and postmenopause and preconception care are primarily women's health issues. So I guess the role of a women's health GP, and especially like myself and Sunita, that we have done a little bit, you know, we're doing extra study in women's health. We certainly follow up on courses and conferences. So just gaining that little bit more insight into women's health problems, I think, is an advantage. But also we're not here to take away from your general GP. We're there as an adjunct, as an aid and a help more than anything. So I guess in essence, women have very specific health needs, and I think having a women's health specialist can be an advantage in that way.
Yeah, I really like the fact that you
Yeah.
alluded to the fact that many GPs have specialty areas of interest. Like some
Mm.
GPs will be interested in dermatology, some will be interested in pediatrics, some will be interested in aged care. Your particular interest is in women's health, and you've done you minimize it. You've done a lot of extra study in the area of women's health. So it's wonderful. I'm so excited that you've come on board at WOOM, because I just know that that holistic care of a woman is really, really important. Michelle, there are so many different aspects to women's health. Can you tell us a little bit about the importance of managing a woman's health throughout her life? What's really important to you?
Mm. Well, certainly women's health, women go through a transition of life, don't they, really? You're starting with your first period, and then, sort of navigating your period with all those different period issues, which I can touch on in a moment. And then, navigating through your next phase of life, which may be preconception care to menopause to postmenopause. So I think in a management of a woman, we also go through a lot of issues relating to those things as well. So the importance of holistic care, psychological care, mental health issues, physical issues that go along with that as well, and social issues, dealing with being a mother and a career woman, so a holistic approach is really important. And certainly as a GP, that having that advantage of caring in that whole person, that whole person nature, I think really helps in women's health, because honestly, there is such a broad range of issues when it comes to women's health too, as we just touched on,
Yeah. Yeah, exactly. And what about, we were talking before we hopped on about the importance of all those screening things that have to happen throughout your life.
Yeah, absolutely. So I can touch on a little bit about that, and certainly probably the thing that comes through first is menopause. So, menopause is, our last menstrual period, and most women, the average age is about, it's about 51. So meeting a woman and talking about all her issues, related to that, and like I said, it's such a broad, big topic for discussion, but it does sort of lead us to things like issues relating to preventative care. So when I see a patient at the age of 51, talking about those things like, have you ever had your cholesterol checked, having your BP checked or blood pressure checked, looking at other health-related issues, diabetes, hypertension, like we talked about, but also things like mammograms, breast care, breast checks. So going through those range of issues as well, cervical screening. So it's a really good chance to actually talk about those, those health-related issues. Yeah.
Yeah. The other one I was sort of just thinking about as you were talking is even like skin checks. I mean, I know that I don't often go to my GP and get my skin checked. It's a great opportunity, I suppose, when you're going through all those things, just to check on every single facet of a woman.
Yeah. Even things like cardiovascular disease, that, the risk of cardiovascular disease is quite low, sort of in premenopausal years. But as leading up to menopause and after menopause, our risk of cardiovascular disease does go up. It does go up, and our stroke incidence does go up. So when you talk about those issues with a woman and looking at some of those things, like including your blood pressure, diabetes, high cholesterol, those are some of the preventive issues that we can work on as well. So GPs are very mindful of all those things, but particularly pertinent to women's health are those cardiovascular, stroke risk, bowel cancer risk as well. So even talking about that too. Yeah.
Do you often counsel women around their bone health as well?
Yes, thank you. Thank you. Yes, just popped into my mind when I said that. So absolutely. So our risk of osteoporosis definitely increases after the age of, as through our postmenopausal years as well. So talking about bone health, talking about baseline bone densities, talking about diet and exercise as well. So what's our diet like? Is our diet deficient in calcium and our dairy products? And quite often I can use dietitians in that instance as well if we need some help with that. talking about exercise, and exercise is pertinent for all of us, as we were talking about as well, trying to do at least 30 minutes most days of the week and about 150 minutes a week. So those issues too. Yeah.
You mentioned using your allied healthcare as well. I love that, because we've obviously got our dietitian at WOOM too. But Michelle, something I'm sure you would talk a lot to women about is weight management as well. Can you talk a little bit to that?
Yeah, absolutely. So there's been, sort of in the last few years, a lot of work coming up with medical management of weight, and obviously diet and exercise. So weight pertains to quite a few things in women's health, and we're going to talk a little bit about fertility and pre-fertility workup and how weight can determine fertility issues, ovulation issues, and also risk of stillbirth and miscarriage, I guess. So it sort of goes into that. But obviously, Tamara, we can talk a little bit more with your very knowledgeable. And also weight management in terms of, as GPs, we can offer some assistance in weight management. So along with diet, in conjunction with diet, our dietitian, and using our dietitian, exercise, and some medical management. So there are some medications that can be used, including Duramine, and some other off-label injections that are coming through, and a few others called Contrave and Saxenda. So there's definitely a lot of options for women. Yeah.
Yeah, I love the fact that, bringing weight management, because we know that, obesity and overweight contributes to so many different diseases, cancers, heart disease, diabetes, as you alluded, fertility issues. And, so many women get exposed to all this dietary and exercise programs online. Sometimes it's just so much noise that they don't do anything at all. Yeah. So being able to come and discuss those things with you as their GP. And then if they have tried all of those things and they've exhausted their options, as you said, sort of moving on to medical management, pharmacotherapy to help them, even just to move a couple of kilos, so they've got some sort of feedback, some motivation to want to keep.
Absolutely. And I think the other thing is a support person, someone who's there, someone who helps them, be accountable for things as well, and having regular appointments. And I think just being that support person too. Absolutely.
Yeah, beautiful. Yeah. So Michelle, this is the money part of things for me, which is the fertility stuff. Yep. Tell me about where you see the role of a women's health GP, particularly in that family planning, that preconception, perhaps even a couple who are really struggling. But, where do you see the role of a women's health GP?
Yeah, absolutely. Well, I think there's certainly increasing evidence that if you're optimizing your health, prior to conceiving, that you can actually improve mum's outcomes and bub's outcomes. Absolutely. So I think as a GP, we actually do have quite a key role in assisting women and their partners, actually, and identifying those, those modifiable risk factors, and also looking at the non-modifiable risk factors. So, and I sort of looked at a few things, and they had a few surveys that only 50% of women will go and see their doctor prior to even thinking about conceiving, which I thought, wow, that's actually quite amazing, which is why they termed it, falling pregnant. So, a lot of the times it's just, here we go, I'm pregnant. So I think certainly our role is to encourage women, and especially even seeing women, in those fertility years, when do you think, what are your thoughts on, children in the future, and sort of, having that conversation initially. And I think by doing that, I think we can make a difference. So number one, our role as well is looking at those risk factors, like I said before. So some of the things that we can talk about, I've included things like, asking about past pregnancy for sure. So are there some things that might help us in the next pregnancy? So, previous small babies, or, preterm deliveries and things like that. Medical conditions, especially. So as women are getting older, and probably studying, traveling, getting careers going, that, women are getting older and falling pregnant later in life. So things like modifiable risk factors, do they have blood pressure issues? Do they have diabetes? You know, things that we, or things like epilepsy, heart disease, autoimmune diseases, things that we can manage and optimize before they fall pregnant. Genetic screening as well. So if there's been any family history or any personal history of genetic defects in previous pregnancies. So things like that we can bring up, and even look at seeing a genetic counsellor earlier rather than later. Diet's probably a big one. So optimising a healthy diet prior to conceiving. Looking at supplements. So folic acid is probably the better known for everybody. They know a lot about folic acid. It's advertised. And knowing that starting folic acid earlier, so at least 4 weeks prior to falling pregnant, and continuing it through that first 12 weeks where all the neurodevelopment's helping, you know, sort of forming with spinal and brain formation. Things like pregnancy multivites, iodine, which is also good for, you know, fetal brain development. Checking vitamin D levels for, you know, fetal skeletal development. Iron is a big one, because we all know that iron falls during pregnancy and preventing anemia. Things like B12 and calcium, and just talking about those supplements pre-preg. Exercise is another big one, you know, encouraging good, healthy weight. When we talked about a little bit of that before. And we also talked about weight. So weight in many respects. So, you know, the higher and even the very low BMIs can affect your ability to ovulate, which can affect your ability to conceive. And risk of stillbirth and miscarriages as well. So smoking and alcohol is the other thing. So there's quite a lot. And there's been no established safe levels of alcohol consumption. So just having that discussion, you know, does she smoke? Does she drink alcohol? Bringing those things up. Psychosocial as well, you know, how are things going for you? You know, history of depression, which may increase your risk of postnatal depression, history of anxiety, how are things at home? You know, how can we help you with that? Environmental as well can have a big impact on women. So where do they work? Are you a vet, you know, that you're working with cats? Do you work with paint? You know, all those kinds of different, who knows, all those different things. And then contraception and family planning as well. So when you're planning to get off contraception, you know, how long do you want to leave it between children, and how old, you know? So I guess, you know, if you're sort of heading towards the mid-30s, that can have an impact as well on obviously your ability, one, to conceive, and two, of, you know, having some other issues with chromosomal abnormalities. So age has an impact as well. So talking about what their feelings are on that. And lucky last, things like, you know, rubella, you know, checking rubella to make sure you're immune. And if you're not immune, to have an immunisation. And then we sort of say, look, maybe you need to leave it a month before you try to conceive, and checking those preventable things, chickenpox, also immunity, and Hep B, checking cervical screening and sexually transmitted infection screening. So there's a massive amount that can be spoken about preconception.
And scary to think that 50% of women are not even enabling themselves to have that conversation before they conceive. So coming and having an appointment with a women's health GP, girls, before you fall pregnant is absolutely key. So Michelle, thank you so much for joining us tonight. Are there any last words that you want to say at all?
Oh, look, along the lines of, you know, there are GPs out there that can help you with your specific women's health concerns. And certainly that can be a range of concerns, whether it be from, you know, your period issues of any reason, menopause, mental health concerns. You know, we are available and happy to help you in any way we can, really, more than anything. Yeah.
Beautiful. Well, thank you so much for joining us. And if you would like to come and see Dr. Michelle at WOOM, you know where to find us. We have Michelle and Dr. Sunita there as well. And it's been beautiful meeting you, finding out about you tonight, Michelle, and also enlightening us more about what is a women's health GP.
Great. Thank you so much, everyone. Thank you, Tamara.
See you later.
Bye-bye.